I do want to, as part of the presentation, to walk through quickly to set the stage of where we stand right now in terms of our numbers since we last met formally. There's been lots of conversations about schools reopening, the governor moving the state to phase three, us as a jurisdiction choosing not to move to phase three. And so just want to provide some updates to those numbers and then go through some of the other key points to address some of the questions that, or anticipating some of the questions that I know that you all may have. So I'm going to attempt to share my screen. Um, it looks like the host has disabled and not allowed me to screen share. I was going to walk through our data dashboard, so I'm not sure who the host of the meeting is, if I'm able to do that, if we could get that taken care of. All right, thank you so much. Okay, so you should be looking at the data dashboard, and this is the front-facing dashboard that we have available for the public, the general public. And so I just want to walk through these quickly to show you some of the trends and where we stand. And so one of the key measures that we've talked about frequently is just looking at the number of new cases. And so when you think back to late June and early July, we saw daily cases dropping. We saw averages as low as 50. And at that time, we moved from phase one to phase two. And since then, unfortunately, we've seen this steady kind of plateau and uptick of cases through the end of July, through August. And as we currently stand in September, or we saw in the month of September, we've seen the cases gradually increase. And so, you know, for the folks at home, again, you know, when there was conversation talking about the state moving to phase three, it's important to understand that the level of numbers that we saw at the state level and the county level were higher than where we were when we made the statement, the move from phase one to phase two in July. Now, following the science and the data, you would think that moving from phase two to phase three, we would have sustained lower daily case numbers on a regular basis before we made that move. So we've received a lot of questions saying, well, you know, the numbers are what they are improving, why haven't we moved to phase three? Well, one of the big reasons is, as you can see, the numbers are actually increasing slightly. And so over the last week, we, along with the state and other jurisdictions, have seen slight increases in our test positivity as well as the cases per 100,000. So for example, our test positivity had been holding at 2.4%. It currently sits at 3%. And interestingly, the state total has also increased over that time and is sitting somewhere between 3.6 and 3.7%. Similarly, when we break down cases by 100,000, and the reason why we do that is it allows for a more even comparison between population differences. Our number went from 6.1, 6.3 to now it's at 8, and it had gone as high as 9.3 earlier in the week. So I want to make sure folks at home understand that we have not driven, unfortunately, the numbers down as low as we would like. Back to, you know, remember in July, we had a couple of days where we saw cases in the mid-30s. Now, we're not there. And so, in fact, our three-day average is sitting at 96 right now. And what that means is we, again, are committed from the public health perspective to not let that be our baseline and say, oh, well, we're cool with that. That's just kind of our ongoing total. We want to get those numbers lower to demonstrate at minimum moderate transmission, which, if you recall from our previous conversations, would be a level of 30 to 35 cases per day, and ultimately get that to low transmission, which would represent approximately 10 to 12 cases on a daily basis in our jurisdiction. Now, what's interesting within that, now let me also take a step back, is we've noticed a couple phenomena across the state. The majority of cases now, new cases that are coming up on a daily basis, are between the ages of 0 and 30. So 25%, approximately 25% of those cases are 0 to 19-year-olds, and the remaining are the 20 to 29-year-olds. Now, this is very different from the pandemic when it started, where we saw it skew towards older populations. And so newer cases, higher percentage in the younger population. And what's also happening is when you look at, we're seeing less severity of illness in terms of, we've had multiple days when we aren't seeing any deaths in our jurisdiction. And we're also the increased cases are happening in the setting of decreased hospitalization. So at this time, we haven't seen a comparable increase in hospitalizations, folks in the ICU, folks showing up to the emergency room with symptoms, and acute bed usage. This number here is the percentage that are tied to COVID and the overall number. That hasn't changed significantly, as well as the ICU bed use or ventilator use. And all of those are proxies to, again, give us a sense of what's the severity of illness in the patients who are testing positive and the symptoms that they're experiencing. Now, the challenge with that is I don't want that to give folks a false sense of security to say, why? Well, everybody gets it. It's fine because, they're normal and they're healthy. Well, because the challenge is we know that young people have older relatives. They come into contact with others who may be more likely and more predisposed to having more severe symptoms of illness. And particularly when we see an increase in cases and an increased percentage in that population, it's a lag period between, being able to see if in fact we're going to see an uptick or a number of cases in those more vulnerable populations and start to see an increase in our hospital utilization by those different cohorts. Now, when we look at the percentage, this is looking at our test positivity. Again, the test positivity number has vacillated somewhere between 2.4% and 3.3%, I think is the highest that we got over the last week. But it's important to note that we have seen an increase, and it's sitting at 3%. What's also been interesting, a phenomenon that has happened since we last met formally, is we have seen multiple days where there have been low test numbers across the state. In fact, there was a day earlier, towards the end of last week, where there were only 9,000 tests resulted. Now, this is much different from where we were in July and early August, where we were averaging 25 to 28,000 tests across the state on a daily basis. Now, throughout this time period, our numbers have held steady. As you know, we rebooted and pivoted our testing program, and now we as a county are close to some of the daily totals that we had experienced, and that's inclusive of the county testing apparatus as well as the entire healthcare enterprise across the county. Now, other data point here, you can just see here's the average number of tests administered on a daily basis. We've got our 3-day rolling average here, and this looks at the number of days within which we have hit our goals. Now, I'm going to stop sharing that piece, and I want to bring up one other additional measure. It's our R0 values here. We have updated those, and they will be updated on our county website. So you can see how the rate of transmission in the month of September we actually saw a peak of 1.4 on September 5th. And the number has dropped back below zero. I'm sorry, not below zero, but below 1, and sits at 0.97. And so in the last couple of days, we've seen an uptick in our rate of transmission. We've also seen an uptick in terms of our red cap numbers. And again, as a reminder for folks at home, the red cap numbers represent the positive results reported based upon when they were actually collected. And we have seen multiple days within the last week of case totals over 100. This suggests that we have seen, secondary to the Labor Day holiday, as well as the state moving to phase 3, we have seen, I feel comfortable saying that we have seen an increase in cases secondary to those things happening. So moving to phase 3 across the state, we haven't, but the state has, and the Labor Day holiday suggesting that we've seen an increase in cases secondary to activities and behaviors during that time period. Now, to go briefly through some updates and always, move to Dr. Stoddard and have time for questions. Since we last met, the governor did provide guidelines, and the health department provide guidelines for schools to reopen and categories to reopen. We met per the state guidelines, we met the criteria for test positivity, as we were below 5. We did not meet the criteria for based upon cases, as we are above 5 cases per 100,000. And I think a couple of days ago, there was only one jurisdiction that actually met both criteria to be able to open up fully for in-person schooling. Now, since the schools have reopened, as we've talked about in one of our previous briefings, we have had 12 schools. All of them have been non-public schools, 12 schools to have cases involving students, staff, or teachers in some capacity. One of those situations, it has been made public now in the news at the Holy Redeemer School. There was a teacher who tested positive. The classroom of students were quarantined secondary to that exposure, and we have seen and we found out that there's at least one of those students who has tested positive for COVID-19 during that quarantine period. Now, in addition to those 12 schools, we have had 7 other schools have to have some level of quarantine in place secondary to the reporting of a COVID-like illness. And again, for the folks at home to understand, the reason why both of these are reported is per the guidelines, schools have a responsibility and businesses have a responsibility to report to the local health department COVID confirmed cases by lab results, as well as any illnesses in staff members or anyone in that facility with COVID-like symptoms. And when COVID-like symptoms are reported, they're given the same guidance as if it's treated as a COVID illness until it's proven negative by a negative lab result. And so there have been instances where schools have called in and said, we have some COVID-like illnesses present. We've provided guidance to quarantine. And when the test has come back negative, we've been able to provide guidance for them to remove the quarantine and go back to business. Now, from the testing perspective, we have launched our 2 test tents at the Randolph, as Councilmember Albanos was talking about his former offices on Randolph Road. That is the site of one of the test tents that we got from the CDC, or the test trailers, and the other one is in the Gaylesburg area at the Lake Forest Mall. They are both operational, and we continue our other test sites, including the Silver Spring Civic Center on Mondays and Thursdays. Now, we have not launched the pop-up testing sites again. We're in the process of doing that, hopefully as early as next week. We have spent the time refining the registration process, the online portals, and coming up with processes to make sure that people get their results in a timely manner. And that's what the team has been focusing on. So the scheduling platform is back up and live. We've been calling folks with their results to make sure they get them within a 48-hour period. And we continue to overperform the mitigation testing capacity numbers and recommendations per the Harvard School of Public Health formula. We have not achieved the suppression level of testing that we've talked about before. And to be perfectly candid, it's a challenge to do that, particularly in the setting that all of the different reopening provisions and guidelines don't support suppression. So it's challenging to balance those two, but we obviously will continue to increase our testing platform to make sure that more folks have access to testing. Our ready responders continue to test out in the community and within the shelter community as well. Now, we have continued to engage with other laboratories to bring them online, to provide support for our current apparatus, as well as explore the opportunity to bring in rapid testing modules in the future, point of care testing. Now, this governor, and as part of his announcement, I believe it's last week, talked about working with a number of other states to create opportunities. I think there's an allocation of 250,000 rapid tests for the state of Maryland. What I can tell you since that announcement, the only information that we have so far is that there will be 250,000 test kits for the state of Maryland, and the priority will be that those tests will be used for nursing home facilities and I believe assisted living facilities. I don't have any further information beyond that to share with you all at this time. Once we find out more, we will work to make sure that you are aware of those prioritizations and dissemination plan. We have met with at least 4 other laboratories to discuss bringing them online to support our platform. We have successfully executed a contract with Scion Labs, who may recall has been working with us over the last month, thanks to the provisions by the Department of Health to help with that bridge contract. So that is formally in place, and we again have met with at least 4 other laboratories and are at different phases in terms of contract processes and looking through their scopes of work. I do want to also mention the contact tracing piece. We continue to work with our state partners, and when we get those reports, they're sent to Naeem, who's coordinating those data efforts and providing that with you all. The consistent themes that come up is we see large family gatherings tied to positive cases, as well as potential worksite exposures. And so we've said this from the beginning that, we have a high percentage of folks who had to go to work throughout the pandemic and not been able to work from home and have been at higher risk for potential exposure to the virus. Now, there also was a question, and I know Councilmember Reamer asked about this. You asked about the phone apps that the governor mentioned as a part of the press conference a couple weeks ago. I unfortunately still don't have any more information to share with you. We've not been provided any more information from the state on that or from the governor's office. So we, again, and I'm not dismissing your question, when we get more information in terms of how the state plans to use that, I'll be happy to share that with you. And the last thing I want to highlight or talk about is vaccine dissemination planning. We had multiple meetings yesterday with the National Capital Region health officers as well as the state health officers. And one of the things that we had discussed from the National Capital Region is, again, recognizing our location is working together to design a regional dissemination plan for a vaccine. Now, you may hear on TV that there is a vaccine that's coming in October. I will say this, and I think I can speak for most other public health officials out there, we're not confident that a vaccine will be readily available as early as October. And Dr. Nesbitt, by virtue of her position in DC, sitting at the state level, has been a part of different conversations with HHS to discuss the vaccine dissemination plan for COVID-19. We're still awaiting, much like these other situations, we're awaiting information from the federal level to determine what their prioritization plan will be and their allocation plan to different states. And so we are all waiting for that information, but we are looking forward to coming up with proactive plans to design a strategy where we're working together across the region to make vaccines available when they become available. My best guess, I'm hopeful that we will have a successful candidate by early 2021 that we will be able to disseminate to our population. Now, just one last thing, I keep thinking of other things since we've not met in a while, is, again, for the folks at home watching, there have been some concerns about one of the vaccine trials in England through AstraZeneca, and I wanted to make sure that folks understood exactly what's happening. Now, in a standard vaccine, or when you're looking at a new drug therapy or drug trial, we do different phases. And phase 3 is important because phase 3 is a large-scale trial. You're testing thousands of people to see what the side effects of the particular treatment or agent is. And what happens in those trials is sometimes people develop symptoms that can't be explained. And when that happens, the trial is halted. And if it's one individual or multiple individuals, they undergo a full workup to understand if the symptoms or particular illness that they are experiencing is tied to the treatment that they're undergoing or the vaccine or medication that they're getting, or if it's tied to something entirely different that has nothing to do with the trial. And so that's what happened with one of the patients in England. They developed neurological symptoms, and they're undergoing a workup to determine if those neurological symptoms have absolutely nothing to do with the vaccine trial or tied with the vaccine. Once that's determined, if it's determined that the side effects that they're experiencing are not tied to the trial, then the trial is able to move forward and continue. And so this also underscores why there is a formal process in place through the FDA to study the potential side effects and effects of the different medications and therapies, so that we have a clear understanding when we do launch at large scale of what the potential side effects are, and we've done everything we can to maximize the safety of that particular treatment or therapy. So that's why these processes are in place. That's why we don't rush them, because it's important to have a thorough understanding of all of those particular things, so that when we release it to you, we can feel confident that it's safe. I will stop there. Turn the floor over to Dr. Stoddard or answer questions, however you want to do it. I'm happy to accommodate you.